Hello, welcome to any community. In this particular video, we are going to discuss about the concept of Rasavaha Srotodushti. It's Srotomula, it's Srotodushti Karana, Srotodushti Lakshana, Srotoviddha Lakshana related to Rasavaha Srotas will be discussed in this particular video. Whenever a person is suffering from the itching, associated skin lesions, etc., from the past 3 or 4 months, associated with oozing, etc., we may say that there may be a possibility of what you say that as Twak is being afflicted, we may say that there may be a possibility of a rasa affliction also. Rasa affliction, rasa dhatu affliction can be predicted. Let us say one more example. 30-year-old female patient presented to you with the history of the reduced scanty menstruation. So this may be indicative of the rasakshaya as such. In the third occasion, the 24-year-old female is having the irritability to the sounds by looking into the by hearing the person, she is getting irritated. All these three examples highlight the affliction of Rasavaha Srotas in all these three key examples. So this is a very important because this is the one that is responsible for this formation of a subsequent dhatu. Maybe Rakta, maybe Mamsa, Medas, Asthi, Majja and Shukra. So that is how the that's how all the three examples shows the affliction of a Rasavaha Srotas as such. So let us start from the beginning. It is having the two types of Srotomula, that is Hridaya and Dashadhamani. So that means whenever rasa is being afflicted, there may be a possibility of affliction of either Hridaya or Dashadhamani in due course of time. Suppose if the person is having the entry of pathogen through the Hridaya region, naturally there may be a possibility of subsequent affliction of organ 2, 3 and 4. Initially there may be a possibility of affliction of a Hridaya itself, wherein the person may have the Hridivyatha, etc., etc. Whereas on the other occasion, there may be a possibility of involvement of either 1, 2 or more dhamani, which in turn may be responsible for the affliction of these dhamani first. As the movement is happening from the Hridaya to Dashadhamani, the affliction of 4, 3, 2, etc., that may be less likely. This is the significance of knowing about the Srotomula as such. That means whenever the entry of pathogen is happening in one of these Srotomula, and if the movement happens from one particular region to the another region, so there may be a possibility of affliction of the subsequent parts if the movement is happening in the same direction as that of the entry of the pathogen. If the pathogen is entering in the reverse direction of a Srotomula, then Srotomula may be afflicted, whereas the subsequent organs may not be afflicted. As far as Nidana of Rasavaha Srotodushti are concerned, Charaka says, Guru Shitam Atisnigdam Atimatram Samashnatam Rasavahini Dushyanti Chintyanam Chati Chintanat. If you split this particular shloka, Guru Shitam Atisnigdam Atimatram Samashnatam Rasavahini Dushyanti Chintyanam Cha Ati Chintanat. So that means Guru Ahara. If the persons are going to consume frequent consumption of Guru Ahara, Shitala Ahara, the person is consuming the refrigerated food substances frequently. Adisnigdha Ahara, excess consumption of unctuous substances. Atimatra Ahara, consumption of large amount of food at a particular time period. Plus Chintyanam Chati Chintanat. If the persons who are having the continuous thinking habit, if they are continuously thinking on one particular object itself, then there may be a possibility of affliction of a Rasavaha Srotas as such. This is an example to say Guru Ahara. Idli or otherwise the paratha, etc., they are considered to be Guru Ahara. So that means if the individual consumes these substances, it may take longer amount of time to have the complete dilation. Shitala Ahara. The substances which are considered to be having the cold potency or cold touch, then that may be responsible for the Rasavaha Srotodushti. Atisnigdha Ahara. Consuming the substances which are having excessive slimy substances, maybe oil in excess or ghee in excess. In this particular example, it is a side dish where we are going to see the oil is floating in the upper part of the particular curry. This may indicate the affliction of a Rasavaha Srotas as such. Atimatra Ahara. If these substances that is being served in the table, if all these are being consumed without leaving a single morsel, then it can be considered as Atimatra Ahara, which may be another major constitutive factor for the affliction of Rasavaha Srotas. Excessive thinking about one particular object continuously may be one of the reasons for the affliction of Rasavaha Srotas as such. As far as Rasavaha Srotodushti Lakshana are concerned, Charaka says, Ashraddha cha aruchihi asya vairasyam arasajñata rillaso gauravam tandra sangamardo jvarahastamaha pandutvam srotasamrodaha klaibyam sadaha krishangata nashognehi ayathakalam valayaha palitanija. Rasapradoshajaha roga. If you split this, Ashraddha cha aruchihi cha asya vairasyam arasajñata rillaso gauravam tandra sa angamardo jvaraha tamaha pandutvam srotasamrodaha klaibyam sadaha krisha angata nashognehe agnehe nashaha ayathakalam valayaha ayathakalam palitanicha rasapradoshayaha roga. If you summarize this, Ashraddha, aversion to take the food. Though he will be consuming the food, but he will not be having that particular desire to consume the food. Aruchihi, the person will not take the food at all, and he will not be having the liking to take the food. Asya vairasya, impaired taste perception. Arasajñata, absence of taste perception. Prillasa, that is nauseating sensation. Gaurava, that is sluggish movement of the body parts or the heaviness of the body parts. Tandra, that is drowsiness. Sangamardo, that is body ache. Jvaraha, that is the spectrum of the diseases where we are going to observe the increased pitta dosha in the body. Tamaha, darkness in front of the eyes. Pandutva, that is mainly related to the discoloration, yellowish white discoloration. Srota samrotaha, that is obstruction happening in the srotas as such. Clybium, that is the erectile dysfunction. Sadaha, here sluggish movement of the body parts. Krishangata, that is emaciation. Agninashaha, that is loss of appetite or reduced appetite. Ayatha kalam malayaha, that is the appearance of wrinkles at inappropriate time. That is appearance of wrinkles to at an early age itself. Ayatha kalam palitani, that is premature graying of the hairs as such. These are the lakshana that we are going to observe when there is Rasavaha Srotodushti. As we have discussed earlier, Ashraddhaya Mukhapravishtasya Aharaha Apyavarana Bhavatyeva to Aniccha. So here Ashraddha refers to the person is going to consume the food, but he will not be having any kind of the desire to take the food as such. That is what we can say the Ashraddha. Aruchihi, if you present him the food, he immediately straight away say, I will not take the food. So whereas Ashraddha, where the person is going to consume the food, but he will not be having the desire to take the food. Asya vairasya, that is Uchidad asyasya, Uchitad asya rasad anyatha tvam. So that is the, if the person is going to consume the, what you say, that the lavana rasa substances, he is not able to perceive that particular lavana rasa. Instead, he perceive either tikta or something other rasa itself. Arasadnyata refers to the total lack of taste perception. Nauseating sensation. If the person is seeing the food, he will be having this feeling of a nauseating sensation, which may indicate pranavaha and udanamata dysfunction. Gurutva, that is the heaviness of the body parts, as if heavy object is being put on his body. He is not in a position to move that particular body, that particular feeling will be observed. Tandra, that is a state which is observed prior to sleep, which is indicative of again affliction of a kapha dosha in this particular occasion. Angamartha, that is all the body parts, they are having the pricking type of pain. It is indicative of vata dosha dominance. This we are going to observe when we start running for a period of 1 kilometer. Who has not at all run from the past 6 months or 1 year, if he has not run, and if he is doing 1 kilometer running, then we are going to observe the particular, what you say, that the Angamartha as such, which is indicative of electrolyte depletion during the activity. Jvaraha, which is indicative of pitta dosha vitiation. Tamaha, that is darkness in front of one's eyes. So here the small insight image, that is an indication. Tamaha, that is darkness which is being observed in front of the eyes. Pandutva, so here we are going to observe the, this is what we can say, the Panduvarna, yellowish white discoloration. Srotorodha, so that means obstruction happening in the movement of the srotas, in the movement of the substances in the srotas. Maybe it may be the, what do you say, that any of the body part, if there is any kind of the srotas obstruction, it may be a smaller one, or it may be occluding the whole movement in the srotas itself. They are indicative of a rasa affliction. Then comes the klaibyaha, that is erectile dysfunction or sexual dysfunction. So the couple are not in a position to attain the orgasm. That is what we can say, the that is klaibyaha. Sadaha, that means sluggish movement of the body parts. Here the image of snail, that is indicative of what we say, that sluggish movement itself. If that is being observed, then we are going to say there may be a possibility of a rasa affliction. Krishangata. See the image as such, wherein the emaciated body parts are being seen. This is an indication of rasa dhatu affliction. Agni Sangadaha, or the Agni Nasha, that is loss of appetite, wherein the ingested food substances are not going to get converted into micromolecules. So that means there will be macromolecules will remain as macromolecules, again, which is an indication that there may be a possibility of rasa dhatu affliction in due course of time. Then Ayatha Kalam Valayah. So here there are images of the two women. Extreme left woman, so she is not having any kind of the wrinkling of the skin, whereas on the right image, that is showing the wrinkling of the eyelids as such we are going to see. That is, if that is being prematurely seen in the young second or third decade, then we are going to say Ayatha Kalam Valayah. Ayatha Kalam Palitah, that is premature graying of hair. This is indicative of what we say, that the rasa dhatu affliction. When you think about the Rasavaha Srotoviddha Lakshana, if there is any injury is happening to the Rasavaha Srotas, then we are going to observe Tatra Viddhasya Shoshaha Pranavaha Viddhavaticha Maranam Tallinganicha. So that is, the person will be having Shosha, the person will have Akroshana, Vinamana, Mohana, Bhamana, Vepana, or Marana may be possible. So here the image is showing the adequate fluid loss from the body. Maybe here the excessive sweating may be produced. Normally sweating may be up to 400 ml in 24 hours, that will be normal. If that is exceeding that particular amount, then we may observe the Rasavaha Srotoviddha Lakshana. Take-home messages from today's discussion are: Rasavaha Srotas is the Srotas which is mainly concerned with the continuous movement of rasa and nourishing each and every part of the body. Hridaya or Dasha Dhamani, maybe one or more Dhamani, may be afflicted in case of Rasavaha Srotodushti. Guru Ahara, Shitala Ahara, Ati Snigdha Ahara, Ati Matra Ahara, and Ati Chintana are considered to be the Nidana for Rasavaha Srotodushti. Ashraddha Charuchishcha Svairasya Marasadyata, Prillaso Gauravam Tandra Sangamardo Jvarastamaham, Panduttum Srotasamrudah Klaibyam Sadah Krishangata, Nashogne Rayatha Kalam Valayah Palitanicha. These are Rasavaha Srotodushti Lakshana. Tatra Viddhasya Anaha, Tatra Viddhasya Shoshaha, Pranavaha Viddhavaccha Maradam, Tallinganicha. These are the Lakshanas which are observed when injury to Rasavaha Srotas are occurring. Dear community, that's all for today. What are the major key takeaways from today's video? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.